So seeing increases in certain parts of the world. Here we see the European average, France above the European average for new cases per capita, Germany below, Canada creeping up, and also India going up as well. Most of this, of course, new variant driven. And here we see the overall picture for the world. And again, we do see this increase. It was going down quite nicely, but now, alas, we're going up again. And again, this is largely new variant driven. So welcome to this talk. It is Thursday, the 25th of March. So let's look at that first of all, the unfortunate increases in parts of the world and globally as an average. So this is from the World Health Organization. Globally confirmed cases continue to rise for the fourth consecutive week. Globally, 3.3 million new cases reported just last week globally. Now, of course, this is not representative at all. We have some countries that are very good at reporting. Europe, the United Kingdom, the United States, Canada, because there's good levels of testing. Other places like Tanzania, for example, that we looked at a few days ago, where basically there's no testing or reporting whatsoever. So this is based on highly incomplete, highly patchy data, but yet still gives 3.3 million. The real number, of course, has got to be massively higher than that. Massively higher. Now, new deaths plateaued after a 6-week decline, and the deaths at the moment were plus 60,000 in the past week was the global figure. So, and of course, this only keeps going up. Upward trajectory in recent weeks, Southeast Asia, West Pacific, Europe and Eastern Mediterranean particularly. Europe and America continue to account for 80% of the cases and deaths. But there again, these are the places typically with the best reporting system. So very incomplete data. Now, the World Health Organization have given themselves a new site, or instigated a new site. So we'll keep an eye on this and see what the data is likely, the quality of the data from this. But looking fairly good so far. Weekly epidemiological update. And the World Health Organization are asking member states to contribute weekly data to that. So again, it's going to depend on it's kind of a garbage in, garbage out situation. Good stuff in, good stuff out. So it'll be good for some countries, but it won't be absolutely a global average, of course not. Now, this is interesting. This is some of the data that they are showing from the World Health Organization from this new site. Now, this is the COVID-19 cases reporting weekly by WHO region and global deaths. So what they've done here, they've put the cases up and down that side, and they've put the deaths up and down that side. Now, this doesn't quite make sense, because if you equate 2 million cases to about, 45, 50 million deaths, 50,000 let me do that again. About 2 million cases to about 45, 50,000 deaths on that side. These don't equate. It gives us far too high a percentage of deaths. But it does give us a trend. So here we have the Americas, Southeast Asia, Europe in the different colours. And we can see that even though globally things were going down nicely, we now see that it's going back up on a global basis. So accurate as far as that is concerned. A couple other graphics there. Cases confirmed and probable. Now, this is male-female, so pretty well balanced male-female. I think it works out about 49 to 51. And deaths, though, we can see are skewed towards the male side. So more deaths in men. And of course, over 80s, large number of deaths, 75 to 79. Less deaths, 70 to 74. 60 to 64, and we can see the death goes down till, thankfully, in the younger age groups, very many fewer deaths, but not no deaths by any means, but greatly skewed towards the older age group and skewed towards more men dying than women dying. And here we actually see another graphic. So we have male and female. So female, slightly more cases, male 41, but men greatly outnumbering, well, not greatly, 59 to 41% in terms of deaths. So some useful graphics there. We'll keep an eye on that site, see if there's going to be anything interesting and useful from it. Right. carrying on with that WHO information, highest number of new cases, Brazil. There's an awful lot of suffering going on in Brazil. Now, I think there is finally some political awareness. Now, we're not going to rehearse the details. It's been an appalling situation, but there does seem to be some political awareness. Not necessarily at the highest level, but let's hope things are going to start to happen more in Brazil now, and particularly in the Amazonian regions where indigenous people have been particularly badly affected. United States, again, new cases. Well, there's actually a decrease of 19% recently. I'm not quite sure of the time period the WHO is using here, actually. But we'll come on to the United States in a minute. Basically, in the United States, things have been going down, but there's been a 3% increase in cases in the past week, which we have been worried about for some time and we're going to keep an eye on. India increasing cases. Again, there seems to be some particular new variant in India with multiple mutations that seems to be driving this. It doesn't seem to be... Well, in India, there will be the South Africa, the Brazilian and the UK variant, but they seem to have unfortunately mutated their own, which does seem to be accounting for a lot of these new figures. France, the increase is mostly driven by the UK variant, as indeed in Italy. So great increases in France. Italy, the numbers staying high, but not higher on the week particularly. So globally, even though spring is coming, there's a lot of increasing cases, and it's due to the increased transmissibility of new variants and the fact that they are now being selected for by evolutionary selection pressures. Now, moving on to the United States, cases, that's 24 hours. So the number of cases now, actually, this is always old data from the Centers for Disease Control. Number of official cases now over 30 million. Deaths in the last 24 hours under the weekly average, but of course the deaths now are approaching 550,000, 541,289 deaths in the United States, still pretty high. Trends in the last 7 days for the states, 53,000 cases per day as an average over the past 7 days, but again, this is several days out of date. Deaths 1,025, 7-day rolling average for the United States. And I think we can, I'm going to show you that in a minute. Well, I'll show you it now, soon I put it on. These are US cases caused by the new variants, according to the official Centers for Disease Control data. And to be quite honest, I would imagine they're fairly embarrassed to put up such inadequate data. But it is live from the United States site, so we see slightly more cases up in Michigan and which is which? Michigan. My geography has let me down. Are they both Michigan? Apologies, people in the States. California, Texas, slightly more. Florida. Well, according to that, they're both Michigan. Apologies, people of Michigan, for my total ignorance there. Right. So, moving on to hospitalizations in the States. Now, new hospital admissions down 71.6% since the peak on the 9th of January, which is good. Back then it was 16,500 per day. Down 4.2% on the week to the 16th of March. Again, quite old data. You know, this is 9 days old now. So Centers for Disease Control data quite behind the times here, really. But it's down, but it's still at that time period still an additional 4,696 per day. So still quite a lot of people being hospitalised in the States, at least in the week up to the 16th of March, where this data is taking us. Now, states particularly... Oh, wait a minute, yeah. So it had been going down nicely in the States, but over the past week, there's been about a 3% increase in cases over the past week. And we have to assume, well, no, we don't have to assume, but that there is a component of this that is new variant driven, despite this rather poor level of data, which is not really representing the situation very comprehensively. 30% increases, unfortunately, Michigan, Colorado, Connecticut, and that's the site for variants in the United States if you want to look at it. So patchy, so significant increases in some states, and we have been worried about this possible trend in the United States for some time. And this is despite this good news from the States, the vaccination data. At least one dose now, well over 85 million people, 25.7% of the entire population fully vaccinated, for over 46 million, 14% of the entire population. Total doses given 130 million. This is impressive levels of vaccine rollout. Impressive. And just out of interest, Pfizer and Moderna are kind of neck and neck in the States, really. So Pfizer 65 million, Moderna 61 million. Janssen, Johnson & Johnson, which I believe is the least expensive by quite a long way of the vaccines, now increasing because it's only just been approved recently, well over 2.5 million. And of course, the big thing about that is one shot. So these people will go onto the fully vaccinated list after they've been vaccinated. Now, a couple of days ago, we put up the new information about the AstraZeneca vaccine. The efficacy of that's been reduced slightly now. I think it's been reduced down to 76%, but still, as far as we know, 100% protection against severe disease and death. So still remarkably encouraging. But lots and lots of you complained about my adding up. Now, I don't know if you can see this. I've done this as a screenshot, but I'm going to read it out. So among participants in the interim analysis, approximately 79% were white Caucasian, 8% were black, African American, 4% Native American, 4% Asian, and 22% participants were Hispanic. Now, these are all put in percentages. And of course, they had up to well more than 100. So my fault for failing to process that and realise that at the time. I probably half realised it, but I was just quoting what they were saying. But that's what they're saying. So it's surprising that an official press release from AstraZeneca, that doesn't equal 100. So there you go. Maybe they'll amend that. But I must say, for an official press release from AstraZeneca, I'm surprised that is, let's just say it's an apparent error. It looks like an error. Maybe it's not. Now, we talked quite a lot about vaccination recently. And I don't want that. What do I want? I want this one. Here we are. Lots of buttons to click. All right, now this is Kerry, whose birthday was 2 days ago. So happy birthday, Kerry. But we noticed that your vaccine, Kerry, was given into the correct position in the deltoid muscle, in the body of the deltoid muscle. So that is good. Now, of course, from this, we can't tell whether the people giving your vaccine aspirated or not. In the UK, that's not part of the guidelines. In Denmark, of course, we know that it is. And a lot of you, especially a lot of you who have been nurses and doctors, agreed with me that why on earth shouldn't you want to aspirate before you inject it? Anyway, watch that video if you're curious about that. So happy birthday, Kerry. Congratulations on your vaccination and your birthday, and it's in the right position. So good stuff. But these are pictures from China from a few days ago. And I must say, that looks like the shoulder there. So that does look a bit low on that one in China there. So I would have said the body of the deltoid muscle is kind of there. Hard to tell from that, but it looks a bit low to me. And likewise, again, hard to tell, but this one does look a bit low again. So, I'd say the body of the deltoid muscle is there. So strange that these fairly basic things don't seem to be getting paid the attention that they should be some of the time. Right, moving on to the United Kingdom. Data up to the 24th of March, so this is pretty well up to date. So what have we got? I think I've got that on the... there we go. We can see the nice reduction in cases in the United Kingdom. Deaths also falling down in the United Kingdom as well, but there it has to be said from an appalling peak. And healthcare in the United Kingdom, again, patients admitted to hospital going down nicely. Still not gone away. Still a few hundred there. 7-day average. The number of people, actually, the number of patients in hospital at the moment, again going down, but still a significant number of people in hospital. And a fair few people still, I think that one's patients on mechanical ventilation, yet still quite a few people in that unfortunate situation. So we're still suffering from the, of course, these hospitalizations are deaths of people they got the infection some weeks ago now on average. Now, data up to the 24th of March. Still 5,605 cases per day, and that's another 38,338 cases over a 7-day period. Now, that was over 24 hours. That was over 7 days. So 38,338 cases over 7 days, 7-day count. But that 7-day count was down 3.3% on the last week. So the trend is good, but it's going down more slowly. Deaths over the last 24 hours, 98, but that added up to 552 deaths over the last 7 days. So still obviously adding up. That gives 126,382 deaths within 28 days of a positive test. 28 days of a positive test, that figure. Now, this death figure here, 552, is down 34.6% on the week before. So we have accumulated a lot of deaths. And the deaths, according to COVID-19 being mentioned as a major factor on the death certificate, 148,125, and this is probably nearer the more accurate figure. So we have lost a lot of people in the UK and still are losing some people in the UK. On better news, first dose of the vaccine, 28,653,523. So about 29 million people now been vaccinated. Second dose, 2.5 million. Vaccines going well at the moment, but there will be a reduction in the next few weeks because supplies are going to be reduced, unfortunately, as we know in April. Largely due to the 5 million less doses we're getting from the Serum Institute in India due to Indian export restrictions. Still nothing new on that yet. We don't know if they're going to be released, so quite a few uncertainties for the UK in terms of vaccine importing from India. Now, people are talking now about vaccine passports being considered in the UK. Now, at the moment, there's a group of ministers that are umming and ahhing about it. The Prime Minister's sort of said that it could be up to individual, for example, pub landlords to decide if they're going to insist on vaccinations. That's clearly not workable. So I think he's still thinking out loud, and more to come on that. But it's likely that you will need, well, I think it's going to be pretty well for sure you're going to need a vaccination certificate or evidence for international travel, and probably for domestic travel, and probably quite a few other things, certainly for some types of employment, I think. But with the European Union, it's much more definite. Now, this is the European Union site, and they are now officially going ahead with COVID-19 digital green passports. So obviously I've put the link there for you to look at for yourself. The essence of it, the digital version can be stored on a mobile device. So there you go. It's going to be on a mobile phone. So there will be probably a paper version, but there will be a mobile device with a digital passport on it. That is coming to the 27 European member countries, and that will be essential for travel within the bloc almost certainly, although there is a proviso in a minute. Citizens can also request a paper version, so something in your wallet, something in your purse, something on your phone. Both will have a QR code that contains essential information, so people will be tracked as they travel around Europe, or will be possible to track them, as well as digital seal to make sure the certificate is authentic. So there'll be a digital seal to make sure that this is accurate. Now, I know a lot of you don't like this, but this is coming in Europe, and therefore I think inevitably will come for many countries as a condition of travel. So where have I gone? There we are. So by summertime, the European Union Commission will set up a digital infrastructure that would facilitate authentication of the digital green certificate. Now, this is my proviso. This requires on the European Union setting up a Europe-wide digital infrastructure that would facilitate the authentication of the digital green passport. Are they capable of doing this based on past performance? It is a question mark. And I'm not getting at the EU here. We talked to Professor Tim Spector the other day, and when he talked to Zoe, they set up an app in 5 days. The UK took, was at least 6 months to set up an app, wasn't it? At least 6 months. And similar problems in Europe as well to set up an app. So whether the European Union is capable of setting up this sort of all singing, all dancing Europe-wide app, but in the next few months, remains to be seen. Remains to be seen. Member states, 27 member states, are to introduce the necessary changes in their national health record system. So this looks like the national health record system will be somehow talking to this all singing, all dancing computer system set up by the European Union. That looks like that is going to happen. Keep clicking the wrong thing today. Get with it. Right. EU leaders to discuss boosting vaccine supply. That meeting's today, so we should be getting things from that virtual conference now. Some question marks whether they're going to put further restrictions on exports, as some member states already have. Now, I think what we'll do now is we'll listen to Will, who's going to report from China. He's lived in China for quite a few years. So let's listen to Will's report now.
My name's Will, and I'm a 71-year-old retired British civil engineer and administrator. I've been living here in Changsha, China, which is about 300 kilometers south of Wuhan, for nearly 7 years now. My Chinese wife and her 30-year-old daughter just got vaccinated yesterday. Until the 14th of March, vaccinations were only being carried out in a limited number of cities like Beijing, Shanghai, Hong Kong, etc. Now it seems they've set a target of vaccinating about 40% of the population by the end of June. That's around 560 million people. Doing the maths, that works out at about 5.5 million jabs a day if there were just one dose. So you can double that for the 2-dose regime. Sounds like a pretty ambitious target if you ask me. We'll see. To date, they've done about 75 million vaccinations. In the city, they've set out about 61 centres to facilitate the project. That's 61 centres in the population of 8 million. That's about the size of London. People make their bookings by clicking on an icon on their electronic health card on their phones, available through the social media app WeChat, known as Weixin here. Everyone is given a half-hour window for turning up for their jabs. You'll see in the video there's no social distancing and only a few are wearing masks. Sounds alarming, but The last case of infection was nearly a year ago in April 2020. Nothing in the city since then, thank God. The province, Hunan, has had about 15 new cases since November, but only amongst new arrivals who have to go into quarantine in registered hotels for 14 days and have multiple tests, all at their own expense. Currently, 11 of those have fully recovered, leaving just 4 still undergoing treatment. Jabs are currently available to healthy Chinese citizens between ages of 18 and 59, so my wife creeps in. A few places like Beijing have started vaccinating older age groups. Hopefully that will come here too, and include foreigners like me. Thanks again, Dr. John, for all you do. Please remember to take some breaks and time off. We value your contributions, but we want you to stay healthy. Blessings. My name's Will.
Thank you for that, Will. I did take the morning off, actually. That's why I'm a bit late today. But right. So Will clearly knows the situation in China. And he's telling us that there's been no cases, no community spread since last April. And this is consistent with other data sources. So this is the case. China eliminated the virus. Now, lots of people say they don't believe a word of it. But Will's not lying to us. This is accurate information. Someone who lives there knows there's been no cases and has seen there's been no cases, despite the limited social distancing that he did point out. Wow, I mean, so basically the Chinese have to do over 1 billion injections for this national rollout. And for a country that could instigate enough social control to eradicate the virus, apart from imported cases, from where they were in December, January to where they were in April, May, I believe they can do that. Now, I'm going to close today with a letter from Germany. The situation is getting absurd. The newest planning are to give every doctor's office 20 doses per week. This is 20 vaccine doses per week. I have chronic disease, asthma, cardiac arrhythmias, losing weight, depression, PTSD, 65 years old. This is Elkie. So we think of you now, Elkie, with these difficulties. I'm not yet allowed to be vaccinated, but if I do, then I'd have to drive or go by train or a car to a vaccine centre to be registered, have to fulfil protocols, an interview with an unknown doctor, and I will get my vaccination. So she has to travel, make sure she fulfills some protocols, be interviewed by a doctor she's never seen before who doesn't know her, and only then can she get the vaccination if she passes those things. Most of the time I will spend waiting. I presume the whole process will last about 3 hours in the vaccination centre. My doctor, who knows me since it's written in, obviously it's not a first language. So basically she's saying here a doctor's known her for years and years and years. His doctor's office is 500 metres from 3 minutes walk from her home, but she can't go there for a vaccine. But he may not yet vaccinate me, and if he will get 20 doses, I am sure there are many patients who need it more urgently than me. Not easy to keep calm. So a lot of these people in Germany with comorbidities and things, I mean, it really is, they really are suffering because this German system seems so sort of, excessively bureaucratic, really. So that's us for today. I've showed you the positions. I've got some pictures to show you. Yes, I've got a few pictures to show you, I think. Problem today is I had too many different boxes to click, and you get your boxes mixed up. Right, this is Alan, who watches in Cornwall, and I'm glad to see he's got a temperature probe and he bought a SATS probe, and it looks like he's taking vitamin C, useful water-soluble vitamin, of course. Oh, this is Will sent this in. This is the bus in China, just a few days ago. So this is the situation in China with the lack of social distancing, and yet no cases since April, indicating there's no community presence of the virus. And of course, this is particularly annoying. This really gets on my nerves. This really annoys me. Why would you wear a mask if you don't make it cover your nose as well? If this gentleman's watching the video, which of course he isn't, just so annoying. You see that in supermarkets, people with a mask below, might as well not bother with the whole thing. You have to wear masks properly. Just one of my pet irritations. Oh, and this is Sherilyn, whose report we listened to the day before, who got some vaccines that were left over. So that was good. And lots of people enjoyed your report, Sherilyn, of course, and found it useful, interesting, and indeed somewhat inspiring, because of you representing all the voluntary work done by so many people. Okay, that is us for today. So basically, new variants are driving an increase in global cases at the moment, despite coming into spring. And in some areas, it's always a race between the vaccines and the new variant. But in the UK, the vaccines are winning. In Europe, the new variants are winning. In the United States, I really think it's too early to tell. Let's hope the vaccines win out in the States as well. Thank you for watching.